When you talk about neurological diseases, you should separate it into, let's say, 4 big pillars. You have the MS, you have Parkinson, you have Alzheimer, you have a few smaller ones. And these diseases are usually not easily diagnosed.
There are a couple of degenerative diseases, for example, morbus Parkinson or multiple sclerosis, where it is difficult to do the diagnosis at a very early stage.
Every year there are papers, from major clinics, identifying, what percentage of their patients have been misdiagnosed. And, it's not a huge amount, but it still does occur.
Sometimes people that have a migraine are misdiagnosed as having multiple sclerosis. And so since there are no markers or biomarkers or diagnostics for these neurologic diseases, it's an enormous problem.
In the literature, you can find that between 25 and 30% of patients are misdiagnosed, which is an enormous amount. And what means misdiagnosed? It means you don't get the right treatment. And when you don't get the right treatment, you have missed the chance of getting cured.
It is important to make the correct diagnosis very early, because we know that the earlier we have the diagnosis, and so we earlier can start with a specific therapy, this will influence the further course of the disease.
So our solution at FBB Biomed is to take the successes that happened in cancer when a medical device known as a liquid biopsy was introduced into the field of cancer immunotherapy.
Our approach to build a liquid biopsy for brain diseases was to look at the product of DNA, which is RNA. The challenge of developing a liquid biopsy for brain diseases using RNA is that most of the sequences are unmappable to the human genome. Perhaps the sequences were mapped by the wrong DNA genetic software. Our approach was to create our own software to use it as a tool for mapping the RNA junk.
So what we did was we mapped the junk.
With this new software, we can organize the junk RNA so to find overexpressed gene sequences associated with brain diseases. We call these biomarkers because they correlate with the presence of a specific brain disease.
When a patient gets his blood draw and the physician gets a result to see that his level of this specific RNA is extremely high, then he can be sure that this is a neurological disorder. Especially for MS, we can differentiate that very clearly.
It looks like whether the messenger RNA test is one in-time test, while currently the diagnosis needs a lot of interventions. All this takes time, and certainly it would be of big advantage if we can solve the problem at once with one test.
There are certain infectious diseases that can affect the brain, but this can be difficult to diagnose. For these diseases, the biomarkers are not very clear. For example, for long COVID affecting the brain, we do not have a test that tells us that somebody actually has this problem. I would be very curious to know whether this technique could help us to identify Lyme disease, for example, or long COVID as the cause of specific neurological problems.
Well, if you think of those two diseases like MS and Parkinson, I would call it a revolution, because the current way to diagnose an early stage of disease is very clumsy. But with this blood draw, it's like that, you take the blood and you have the result. One life, one test. When you translate it into the real life, it's a totally new way of approaching medicine.